I ask the Minister if the capital plan for the Respite Centre in Cavan, which will cater for children, has been launched and the timeframe for the delivery of this service. Thank you.
Raising this issue. So, capital funding proposal has been submitted to the National HSE Office for a bespoke standalone respite service facility in Cavan, Monaghan for children from 0 to 18 years of age with an intellectual disability with high support medical and complex needs. It's important to say that the capital plan hasn't been published yet, but it's important as well to say that the application has been submitted. So I can't at this moment in time confirm on the floor of the Dáil, but it is a priority. It is a priority. I've met with families, I've met with the public representatives, that there is a dire need for respite for children in Cavan, Monaghan. And I have said it numerous times here at this stage, sharing a respite centre every second week with adults I do not find acceptable. I think we need full-time respite for both the adults and the children. So the Government and the HSE have had regular conversations and very much aware of the importance of the respite service provision for families for both children and adults with disabilities, and it is important that we build on that. The respite is a key priority area for the HSE for people with disabilities and their families, and has been significant investment in services over the last number of years. So in 2021 we added 9 new houses which brought 10,000 additional hours. In 2022 we added 3, but there were complex specialty needs which added 4,000 extra bed nights, and in 2023 we added another 5 respite houses which added 7,300. So as the capital plan is just being finalised as we speak at this moment in time, I know that Edel Quinn has done Trojan work in working with the team on the ground in Cavan, Monaghan in putting together a proposal and a design for adjudication by HSE National Office.
Thank you, Minister. Yeah, as you say, currently there's one respite house between 2 counties catering for adults and children, so on alternative weeks only, and that is entirely insufficient and has been for years. So, people who are getting some respite, in most cases it is insufficient. There are many then on a waiting list that are not getting any. And then I even talk to people who haven't applied at all, even though they need it or know that they will need it in the future, but feel it's pointless because they hear of others and they're waiting so long. And then there's some who actually are unsure how to even apply. So, and that just points to a deficit of information being provided to people, around disability services in general and what supports there are. But I mean, any house has 5 rooms. Now, I was talking to some of the staff there actually as well. They're saying, for example, a lot of the cases they're seeing coming in there are autistic people, both children and adults, and there's no sensory room. And there's a big need for something like that. There's a big need for maybe an upgrade and an extension in that house. But there is definitely a need then for a separate house completely. So it's just to clarify, Minister, are you talking about one house between the 2 counties though still? Like one house to cater for children between Cavan and Monaghan? Or would you foresee a time when there would be a house for children in each county? Thank you.
Absolutely. Of course you would want to be that ambitious to ensure that every county would at a very minimum have a respite house for children in both Cavan and Monaghan. But at this moment in time, the proposal that has come in, that has been submitted by Edel, it is a respite house for both counties, so it is operational full-time. The capacity that adds is actually, if it's a 5-bedded house, which is my understanding it would be, is a 5-bedded house with 2 separate doors, and that separate door would ensure that a person who has sensory needs, in actual fact, that they can actually be supported to meet their needs, and at the same time, the mild to moderate, they have their own separate front door, so the building is functioning full-time at all times, and that everybody is catered for. So you never end up in a situation where the house actually has a multiplier effect of not functioning for everybody. 1,800 bed night capacities would be the 7/7, which is exactly what is required, which will add substantial accommodation, which would mean that people who are not applying or who are in need but don't know how to access at this moment in time, their needs would be met.
We also need to avoid the situation, Minister, which happens on occasion when there's an emergency case going into the respite house and then nobody else is actually allowed to use the house and they cancel at the last minute. I'm also aware of people, like I know, for example, one woman who knows she's an operation coming up in March, needs respite care for her son, but because it's the Children's Week and he's an adult, is being told, no, there's no possibility. Like, you know, so there's situations there we need to find solutions for. Now, I've written to Adele Quinn on this. I haven't heard back from her, but it's something that needs to be resolved very quickly. Obviously, if there were the two houses, it could be resolved very, very quickly indeed. But can I just also point out, I suppose, the need for respite has increased as well due to the lack of functionality of the CDNTs. They are not functioning at all well. In County Cavan, for example, we are working at something like a 60% vacancy rate, so it's not working actually. It's not operating. Children are not getting services. I'm contacting the team. They're saying they're going to be in touch with families. They don't get in touch, or if they do, it's not to offer supports or services. So a lot of families are getting to crisis point now where they can't cope, and some have more than one child affected as well.
Thanks very much, Deputy. So it's important to say in Budget 2024 that myself and Minister O'Gorman we secured for the first time ever the largest budget for respite, which was 15 million, and in a full year that's 25 million for respite alone. So we have a very ambitious plan in 2024. The alternative respites, the likes of Little Wonders and is it Kilbixie Paddocks, provide alternatives on Saturdays and after schools as well. We need to add capacity and support those providers. In actual fact, we need to be ambitious and actually encourage more providers to come into that space in the after schools or in the Saturday clubs piece. And in relation to Adele, I've no doubt, because she will come back to you on that, and she always does do her absolute damnedest to support families where they can, particularly where there's scheduled care requirement. And finally, I think it's the Enable team that's in your area. So we had a recruitment campaign of which 500 people have advertised for it, and the interviews are starting now. So hopefully I will get to meet Enable in the next week to see how they are supporting their 20 CDNTs nationally and that drive.